Mental illness is a complex issue with wide array of diseases in which depression is one of them. Depression is a debilitating and pernicious cluster of symptoms that may persist for a period of weeks, months, or even years. It is an affective disorder that presents with depressed mood, loss of interest or pleasure, decreased energy, feelings of guilt or low self-worth, disturbed sleep or appetite, and poor concentration.
It's a major psychiatric ailment where the individual goes through a spectrum of disorders, mainly psychological, physical, and it has clear-cut criteria for diagnosis. You have mood changes, the mood is down, has psychomotor retardation, and some other features. It's something that is often than not observable on the individual. Other people around can easily say that the person is losing interest in the environment, the person is getting withdrawn to him or herself, and the general physical activity are down, they are retarded. So by and large, that's what depression is all about.
It's actually a form of mental illness that is quite common. It's one of the commonest kinds of mental illness. It's majorly characterized by undue sadness. And when I say undue, that's because usually you're not able to pinpoint exactly why the patient is sad. Or probably even if you're able to tie it down to something in particular, the sadness is usually in excess of what you expect.
Okay, basically speaking, depression is a state of mental health, a negative one to say, where the individual experiences sadness, sorrow, perhaps over things that the individual had lost, or maybe over some calamities that have befallen the individual at some point in time. So this issue, the thinking of what was lost, of what travails one has gone through or is going through, definitely leads certain people into a state of depression.
Depression is one of the most commonest mental disorders in our society today. According to the World Health Organization statistics, about 300 million people around the world are suffering from depression. In Nigeria alone, about 7 million people, which represent 43% of the people suffering from depression and drug abuse in the country.
Depression is really a significant problem in Nigeria because it has a toll on you as a person, both psychologically or mentally, and it also can lead to some physical problems if it is too much. I'll give you an instance. Somebody who lost all he had, lost the mother due to Boko Haram activity, lost the brother was actually slaughtered right in his presence, lost his job and everything. That kind of person can go into depression, and if that depression is not really tackled on time, it can lead to suicide attempts or suicide that is completed. So you would agree with me with that little example that depression is actually something that needs to be tackled so that it will not lead to loss of life of the individual.
Depression is very rife in the Nigerian society. News on daily basis of youth that commit suicide due to breakup in relationships, failing of courses in school, inability to solve financial needs, and for many more.
No, it's clear. It's a fact. Especially for men and even for women too. When people find it difficult to make ends meet and are pressing financial issues such that your financial load is more than your financial strength. So the person now runs into individual, and there can be very tight situations, medical, somebody wants to be treated, has an operation, somebody wants to deliver, there's somebody to pay, somebody needs blood in the hospital. At times, educational want to pay school fees. If you don't pay, they will withdraw the child from the school. And you have police cases and things like that. So there are issues that weighs heavily on the individual, and they cannot find a way out, and they finally depresses them.
First, if you have somebody who is depressed, the first thing is to bring the person to the hospital. because we have different severity of depression. We have mild depression, we have just moderate, and then we have severe depression. If you have somebody who have mild depression and then you catch the person early, it will not progress to the worst one. And the worst form of depression is the one that comes with suicidal ideation, suicidal thought, and eventually people commit suicide because they are depressed and then they feel like there's nothing worth living for anymore. So before it gets to that stage, if you catch them young and then you harvest the whole thing and you cure it, you'll be fine. So that's it.
Depression and anxiety symptoms are reported to be common among university students in many regions of the world.
There is a difference, but just like I said, they're like twins. They at times move hand in hand, right? It's said that even those who are depressed or who eventually get depressed are people who premorbidly have very high levels of anxiety. There are people who get anxious excessively over little things. For people who have such personality, they may eventually come down with depression. Then even in depression, so we know that even anxiety that has tarried for a very long time, that has not received treatment, may eventually lead to depression because the individual is in distress. You are always anxious, probably in social settings or just generalized anxiety that is free floating. You're always anxious in every situation. If you don't get management for it on time, it may eventually lead to depression. For somebody who is depressed also may have symptoms of anxiety, coexisting with depression. So they are actually two distinct entities, but most times then there's what we even call the mixed depressive anxiety state too. So at times you may have them together.
There are many types of depression and they differently affect an individual.
The sadness is usually in excess of what you expect, right? And it's usually a prolonged form of sadness. We all feel sad once in a while. Definitely there are some things that we experience that makes us feel sad, but usually you notice that the sadness is not something that is sustained, right? Over some period of time, you eventually get back to your usual self. If probably you are in an environment where they've said something that should warrant you smiling, you will smile. But usually in depression, it's a prolonged form of sadness that it doesn't respond to emotional situations around the individual. So they are sad for most part of the day, usually unduly. They have what we call loss of energy, or what is otherwise termed as anergia. They just seem not to have energy to do things. They would rather just sleep or probably just withdraw themselves, into their shells. Also, there's loss of interest in otherwise pleasurable activities, what we call anhedonia. So for someone who, premorbidly is someone who enjoys watching football, and probably the European League is coming up and you get to see this kind of person, rather than watch football, you'd rather just be in his room sleeping, not wanting to interact with anybody. You should actually begin to suspect that there's something wrong. So there are a host of other symptoms, but just like I said, majorly those are the three major symptoms of depression.
Depression is identified as one of the 4 major diseases in the world. Risk factors include a family history of the condition, major life changes, certain medications, chronic health problems, and substance abuse.
No, there may be a little jet, but it's not. It's something mostly acquired. It's an acquired psychiatric disorder.
We don't want to use a disease because, when you say a disease, like you can tie it down to a pathology going on, like there's something particularly wrong. For depression or mental illnesses generally, it's a host of several factors. You cannot at times say it's this thing, At times you're able to say, okay, probably this precipitated it, but it should have been something. When you look at it as a whole, it's a host of several factors. There may be genetic influence, coupled with some psychosocial adversity or psychosocial problems coming into play. There'll be just one thing that may now precipitate the illness, but obviously it's not that one thing that will cause the illness, right? There'll be the individual would have been vulnerable. Because just like I said, it's not, for instance, we know that adverse life conditions, for instance, can lead to depression. But you would agree with me that it's not everybody that goes through an adverse life condition that will eventually come down with depression. So that people who, ab initio are already vulnerable. There are some other underlying factors to it. So you cannot really say that, okay, it's this. For instance, somebody who has brain tumor, or probably an abdominal disease, once the surgeons go in and remove whatever is causing that pathology, it goes. But for depression, you can't say, okay, this is it. Let's go there and just remove it. So it's actually a disorder. It's not something that is specific.
In the balance of religion, depression is somewhat linked to trials and tribulations, as it is assumed at a point in the life of every individual. There is a point where the smooth going gets tough, and only with patience, perseverance, and faith would one come out of such situations.
The Quran says in 3 different places, "La yukallifullahu nafsan illa wus'aha." Then it says, "La yukallifullahu nafsan illa ma ataha." So Allah does not overburden a soul beyond what it can bear. Now, this is clear. The implication of this verse is that Allah, who is the creator of the soul, knows the limit, the elasticity of each soul and what it can bear of sorrow. Whenever Allah will put a soul to test, He will not test a soul beyond what it can bear. Now, what a soul can bear does not, of course, mean that it has to be minor or it has to be major. Yeah? So, when Allah tests anyone, He expects the person to be patient and to persevere. But then, because it is a natural instinct to be sad, the individual might be sad, and then from sadness, he falls into depression. So this state of mind, that's the depression now, does not conflict with the fact that Allah does not test a soul beyond what it can bear, because He is the creator, He knows what a soul can bear, and He will never put a burden on a soul other than what it can bear. But that aside, the ulama have mentioned that the real interpretation of this verse is that Allah does not put obligation, religious obligation, on any soul beyond what it can carry out. Now take for example, the angels, they have limitless abilities, that only Allah knows. We cannot be angelic in our character and disposition. Angels do not eat, they do not drink, they do not have sexual desires, they do not sleep. They are like robotic creatures. Wherever Allah commands them to go is where they go. Human beings will have a mind of our own, right? We eat, we drink in order to survive, and we have some of these natural instincts that keep the human race going. Without the sexual instinct in us, the human race might have gone into extinction. So, whatever Allah will burden the angels with, it is what they can bear. Not eating, not drinking is what they can bear without any stress. For us, we can't bear that burden. That is why He has commanded us to eat and to drink. So the real meaning of this verse is not about the calamities that will strike the human soul. It is about the religious obligations that Allah will place on each soul. Allah will not command you to do what you cannot do as a believer.
Target located. Engaging target.
University life marks a transitional period for students, during which some students move away from family and home for the first time and lose the traditional adult supervision and traditional social support. These changes have been recognized as risk factors for developing depression.
I was depressed sometimes around 2018, and what caused the depression was I had 7 carryovers when I was in 300 level. I'm a brilliant student, so I felt what could have caused it for me to have carryover. And then school fees issues came in, so I was looking at it like, so I want to graduate with my friend, so I was always down. So then my friend noticed, I didn't tell anybody that I had 7 carryover. So my friend, they noticed how I was self-isolating myself, I don't eat well, so they reported me to the guidance and counseling in the school. So I went there. The woman asked me some questions and all. Then she told me that I was depressed, and she called my friend in, my close friend, and talked to them how they can help me. Like, they should talk to me that it is not the end of the world. I was placed on some drugs, and after a while, I felt better.
I've been diagnosed with depression since when I was in SS1. It was due to the fact that my height was looking abnormal, and academically I was not sound, which made most of my peers and my teachers look down on me because I was tall and I was not useful. Lots of insults and bad comments made me feel sad and made me feel depressed, which I grew with over the years. But now I'm on medication, so I believe I'm getting better with it.
When it comes to depression, I feel depression is a topic that isn't well spoken for. It's as sensitive as it gets. It's taken with leisure hands. Depression happens to the best of us, the people in which you feel they can't get depressed. I once happened to have a friend, Yusuf. He died years back. When you meet Yusuf, you feel he has nothing to worry about. He was someone with the best smile I've ever seen. He was someone that loves doing everything. But I guess life got the best of him. He died in the year 2018. He took his own life by taking sniper.
Depression among Nigerian youth and students have been linked to several factors, ranging from substance abuse to stressful life events. These behaviors have been associated with students from time immemorial. The media, as a social agent, has been saddled with so much responsibility, and they could play a very important role in the alleviation of depression, from organizing educative programs to providing outreach.
Yes, I agree totally with you that depression is underrated in this part of the world, most especially in Kwara State. However, in states like Lagos, where I trained, the awareness is a little bit higher than here. But we are trying as much as possible to make awareness about mental health and depression at large. Part of the awareness we are trying to do is to get the government of the day. First, the authority of the General Hospital is becoming more aware of mental health problems and how to tackle it. Then we are trying to partner with the government of the day, and we are, like I said before, we are trying to do an awareness, which is the World Suicide Prevention Day, which is coming up October 10th, 2020, and our venue is going to be Seminar Hall, General Hospital in Lorry. You are actually invited to if you can make it. So those are the steps we are taking, and then we make a lot of publicity about stigmatization. We stop the stigma, because some people, mere hearing that you have a little bit of mental abnormality, might not want to share spoon with you anymore. Meanwhile, it is not contagious. It is not an infectious disease that is contagious. So you can actually share spoon with that kind of person. You can hug the person. Even your girlfriend can get depressed. Are you going to say you are not doing again because the person is depressed? That can actually come out of the depression anyway.
Depression is classified as a disorder that can grow into a major disease.
There are specific antidepressants that are used to treat depression. Drugs like imipramine, drugs like transcopal, even tryptizol can be used to treat depression. You can also treat by counseling, counsel the individual by physical interaction with the individuals. So there are different modalities of treatment, but the mainstay really is drug therapy.
It's something that is manageable, right? It's something that is manageable. We have several types of depression, right? And usually depression is even a disorder, is a mood disorder, just like we said. With or without treatment, the lifespan would be like 6 to 18 months. The individual would eventually come out of the depression, right? But why we insist on treating is because we all know that it has some attendant consequences that if we don't, treat on time and try to nip in the bud, may even cost the patient his or her life, and we don't want that happening because suicide is a complication of depression. Then we have what we call severe depression with psychotic symptoms. Some people may actually have psychotic symptoms like hallucinations, hearing voices of people they cannot see, talking to them, seeing things others cannot see while they're fully awake, feelings that people are persecuting them and they want to harm them. So in situations like that, you don't want to wait and say, okay, we all know that with or without treatment, they would eventually, resolve. No, because at that point, they constitute harm to themselves and even to people around them. They are going through a lot of distress. So you want to treat as soon as possible. And usually between episodes, they do excellently well. For someone who has had a previous episode, there's a higher risk of coming down with another episode. But just like I said, once they use their medications, adequately, they do very well. And even we use medications, once they go back to premorbid states, they are fine. Use medications for about 6 months afterwards, and you can then stop and just monitor over time.
Yes, I would say counseling is more effective for kids that have depression because, number one, the drugs, the antidepressants that we give people who have depression might be way too heavy for them, their body to metabolize. It can cause harm and a lot of side effects in them. And most times we don't really diagnose children as having depression. However, we rather give the mental illness they have another name. You've heard of antisocial personality disorder, attention deficit hyperactivity disorder. So most times children don't get depressed like that. You don't really call it depression. You see more of depression in adults. You understand? So we really don't give antidepressant to children like that. We rather do counseling, psychotherapy, counseling, and just talk to them.
And this is the most important thing, is prayer. Now, when somebody is so sad that he falls into a state of depression, such a person needs ruqya. Ruqya is spiritual exorcism. It's a form of adhkar that can be recited by the person himself or can be recited for the person, in his or her presence. Such a person should be assisted with prayer beginning with ruqya. So it will help the person to heal faster, because shaitan is always where a person is sad. When somebody is in a bad state, shaitan will be there to continue to fuel the sorrow, so that such a person loses hope in Allah and say, look, oh Allah, why have you done this to me? I have worshipped you this long, I have done this, so why me? Shaitan will continue to fuel it. But when you do ruqya, shaitan will run away. So if you have anybody that is depressed, one of the things that you should do is to assist such a person with prayer, beginning with ruqya. Not just praying for that person, behind his or her back, but doing ruqya for that person, so that it will reduce the interference and influence of shaitan, in inflicting the person more harm. Speaking to psychologists and counselors. So if you have a child that is depressed, or a sibling that is depressed, or friend, one of the things we need to do is to introduce such a person to a professional psychologist and counselor who can speak to the mind of that person, advise the person on what to do in order to get out of depression.
The situation of Nigeria, which ranges from insecurity, poor economic growth, poor governance amongst others, is sufficient to push every other citizen into depression. The Nigerian mass media should change the notion of bad news sell fast, as most news content as of today lead to depressive thoughts. Parents, guardians, and folks should observe their words in the university for changes in behavior and ensure to give the needed support.